Okay, now my name is Cook4545 and welcome back to Trauma Center, New Blood. In the last part we've done stuff. Yeah, stuff. Like you can use speed to do that, and none of that. And this we're gonna do Cursed Burning. I just continue on with because I don't like this objective. This one was stupid. Hey, let's continue on with.
The NIH has received a request for help from a hospital in Texas. They're having difficulty with the diagnosis. Based on the patient's chart, there's a good chance that it's stigma.
So this is what we're dealing with,
These two pictures were taken only a few hours apart. Look how far the focus has shifted. And its size has increased drastically.
A biopsy was attempted, but they were unable to obtain a sample of the pathogen. The patient will arrive in roughly 3 hours. Vaughn and Blaylock will be performing the surgery.
We'll check the patient's condition upon her arrival and then proceed with the operation.
We're treading on unknown territory, so we'd appreciate your support, Dr. Suji.
I highly doubt that you two will need my help. But I'll get ready nonetheless.
I don't know if this is a new strain of stigma or the last one. So I'm gonna use Marcus because he's better for the last one. But I don't know if it will actually be good.
The patient's vitals are stable. Blood pressure 110/60, heart rate 60 beats per minute.
Any case history?
She was involved in an accident 2 months ago. Laceration on the right thigh. Looks like they used artificial blood for transfusion. Q-heme blood from Syntec Labs, to be exact.
Are there any contraindications?
None that I'm aware of, but can you check with them just in case?
Will do.
The affected area is the liver. The course of treatment will be determined during the procedure. However, I have a feeling this will be different than the professor's case.
So it is different.
Even so, I'm sure our experience with stigma will prove invaluable. Let's stay positive.
I don't know which strain it is. I don't know which one would be better to use. I'm gonna use Marcus.
According to the test results, this stigma is completely different from the one we saw before. There are some similarities, though, such as high mobility.
It tries every conceivable method to make its victims suffer. It's like a nightmare.
If it is stigma, then there must be a core somewhere, even if it looks different. If we can find and attack it, we may be able to identify the key to stopping it.
A core. Now that you mention it, there was something in the report about that.
That's right. We saw something like a core when we were operating on Professor Wilkins.
I'm surprised you remember, Marcus.
Call it a hunch.
A hunch? Well, at least we have some hope of defeating it now.
I'll be praying that I don't have to get involved.
It's haunting me. Wherever I go.
Dr. Vaughn?
It's nothing. Let's end this nightmare.
Since it says high mobility, I'm gonna trust it and use Vaughn. If anything changes, I would let you know, I guess.
Okay, let's begin.
Alright, continue on.
The exact nature of this stigma and the types of damage it is capable of are still unknown. Stigma confirmed.
Yeah,
It's much larger than before.
Vaughn would be useful. Actually, I don't think neither one of them would be
That
useful.
must be its core there in the center. The plan is to use the laser to incinerate it, but
So this is strain. You just drain it. Laser to core mixture and to tumor stone. Yeah, we explain. Valve touch would be useless in this operation, so Dr. Vaughn's might be better,
We can't
but
do anything to it since the core has enveloped itself within the surrounding cellular tissue.
yeah. I don't think his will also be useful.
The tissue itself looks highly viscous. Let's try draining it.
Good job. The amount of cellular tissue around the core has decreased.
Okay, then is this a tumor? Let's burn it with the laser.
You want to laser that whenever that happens. Laser to core.
The core's been exposed. Use the laser to incinerate. It's
Like
working.
that.
The core's being covered by the tissue again. Please drain it.
These you want to laser before they become hardened. You don't want to harden them.
There is still tissue left inside the patient. Please drain it.
You have to drain these cores before they become hardened. You have a limited time.
Just a little more.
Did it split up?
You want to make sure you get the one.
The core has to be in one of them. Use the drain to find
Get the one that doesn't have the core in it, because that would be the one you have to deal with. Because if you let it go, fucking come on.
The remaining tissue is hardened? Does it dry out over time?
We can't use the drain on the hardened tissue. Use the laser to soften it up.
More of the tissue has been created. Drain it immediately. Vitals are dropping. Is the tumor hardening?
Let's extract
Vitals
it
are
with a
dropping?
power procedure. First, use the
I'm
drain on the
fucked
hardened
up,
tumor.
so I'm gonna have to. Ah, fuck.
That's it. Leave the rest to us.
I made a mistake. That's why you want to take care of the one that doesn't have the core in it.
The exact nature of this stigma.
That must be its core.
We can't do anything.
The core is being covered.
Is this a tumor? Let's burn it with the laser.
There is still tissue left inside the patient.
Yeah, you don't want these to harden at all, because they do apparently lower the vitals at all.
Just a little more.
Did it split up?
That one has the core, so we want to take this one out.
The core has to be in one of them. Use the drain to find it.
There you go.
We did it. No presence of stigma can be detected. Let's...
That was an amazing operation. Let's close her up and be finished.
We were able to deal with it. Somehow.
I hope this is the last time we have to perform an operation in the dark.
We're finished. Great work, everyone.
Oh, it's nice. Messed up at the beginning. Oh yeah, everyone. Yes, an S-Link. Mass decision. We don't talk about the first time.
Stigma's mobility far exceeded our expectations.
You all did a great job treating it. I'm glad you're with us.
Would you expect any less from Caduceus' own special disease counteraction team?
We'll hold a conference on this case of stigma within the next few days. Of course, I'll need you to speak regarding today's operation and the patient's progress.
So yeah, Marcus's touch would be better during that operation to slow down time if you're having trouble with the things being hardened.
Your report will also be forwarded to Health and Human Services, so please get started immediately.
Just give me a strong cup of Jill, and I'll crank it out.
Good. You know, there was no way we could have anticipated Stigma's metamorphosis. I was amazed at how well you adapted. I know you have the healing touch, but even so...
I guess I'm just lucky.
The Deputy Secretary.
The results from the liver exam indicate that the patient has been making satisfactory progress. She seems to be recovering well, but it's unclear how this disease was transmitted in the first place. We should continue monitoring her for at least another month.
I see. Well, I think it's safe to say that the treatment was successful. How about the pathogen itself? What have we learned? And please, keep it brief, Robert.
My pleasure. Although our analysis is only partially complete. First, the biopsy. Stigma did not match any known organism, meaning it's a new species, so we'll have to come up with a name for it. So how about it, Dr. Everett? You'll be a grandfather one of these days.
Well, my son's only 12. All he thinks about is football.
Oh, well, in that case, I'll ask someone else. Now, regarding the spectral analysis, our attempts to determine its structure resulted in failure.
What? How is that possible? I've never heard of that happening before.
We tried a different machine, but the outcome was the same. We screened for nucleic acid, proteins, glucose, lipids, and ATP, but there were no matches. Stigma consists of an organic compound that is completely foreign to us.
What? This will change the way we think about life itself.
Whoever is credited with its discovery will surely make history. From a medical perspective, it's fortunate that Stigma's infectivity is weak. We're trying to culture it, but so far there's no sign of growth or multiplication. It's going to be difficult to determine the means of infection as well.
This is more serious than we thought.
Madam Director, we have an emergency. Leslie, we're in the middle of an important conference. Deputy Secretary Marshall has collapsed. He may have intraaxial hemorrhaging.
Oh, it's the brain.
George Marshall, from the Department of Homeland Security?
All right, let's adjourn the conference. Leslie, I want you to prep Operating Room 3 for him. Vaughn, Blaylock, you two will be performing the procedure.
You want us to operate on a high-ranking government official?
I was just gonna say Valve staying in touch would probably be better for this.
I'll explain the details before the operation, so please go make the necessary preparations.
It's been 35 minutes since he collapsed. He's a 9 on the coma scale with mild tachypnea.
We're waiting on the CAT scan results, but it's most likely a case of subarachnoid hemorrhage.
This is his chart from his previous admittance. We performed deep brain stimulation to treat his dystonia.
And he was able to recover from that. Incredible. Looks like the system's produced by Columba and Cornix, the same company that made Elena's pump.
Yes, it's now a subsidiary of Humani. If you have any questions about it, you can ask Isabella.
Director, what's this shadow here on the X-ray?
Oh, that. It's a hippocampus chip. We implanted it at his request.
He didn't want to forget anything, so he opted to have his memory augmented. I assume they're keeping it quiet. Do we need to worry about being in violation of state law?
We don't have time to discuss that. Now, the hematoma is far enough away from the electrodes, but take care when using the thrombolytic.
Okay, we'll head over to the OR then.
This is gonna suck. Use Valerie staying in touch if you have trouble with it. To prevent the virus from dropping Marcus's will also be good. To prevent it from popping. But I'm gonna
These
use
are the
Val.
results from the CT. Please take a look. A number of aneurysms have been detected. Some of the blood vessels have already burst and are hemorrhaging heavily inside the brain. First, we must clear the excess blood from the area. Then we need to treat the aneurysms. Remember, this is brain surgery. Please be extra careful when performing this operation.
Even a tiny mistake could debilitate his brain. We better be careful.
This will require extreme delicacy and dexterity. We need to do our best. Beginning the operation.
Hopefully you don't have to cut inside, so it just immediately.
Since we're operating on the brain, even the smallest mistake can be fatal. We'll have to be extremely careful.
Before you do that, make sure you stick him in the brain.
That bulge in the vein is the brain aneurysm. Let's remove it before it bursts.
I'm getting the sedative ready. Let's detach it with the scalpel while the aneurysm has been detached. The aneurysm, please hold the vein. Once you pick up the vein with the forceps, the vein has been reconnected. We're done treating this brain aneurysm.
The test said there were multiple aneurysms, though.
There's a chance that any of these vessels will turn into aneurysms. Have the magnification tool ready. Let's shift our viewpoint when necessary, and
There it is. Let's treat it before it bursts.
there's more where we're not looking. Once we treat the ones in sight, we have to quickly change our focus.
sedative's effect
Fuck.
is worn off. Please inject it again.
Let me just stick him for brain. His brain full of stabilizers apparently. Oh fuck. Man. There you go.
Doctor,
Fuck.
please inject it into the bulging vein.
Not fast enough apparently.
It looks like the situation's calmed down for now. But his vitals aren't stabilizing. Let's wait a moment and see what happens. Doctor, please hurry! If all of these burst at once... Vitals are dropping?
As you can see, there's a lot of wounds I'm not treating. I'm sorry, I'm trying to focus. As you can see, the vitals are dropping more because there's a lot more stuff going on. Like a lot of wounds. So I was being risky with doing everything at once. But I made it. I'm gonna have to use that one to be treated. Not fast enough.
Vitals are dropping?
I'm gonna treat this one next. Because one of the objectives is don't let anyone bust. So Marcus's might have been better for this to go faster. Time as well is the issue. And if you didn't want it to bust, then Marcus's would have been better. A Valve, just as if you literally cannot handle it.
His vitals are stabilizing.
Especially at that last point.
It looks like it's finally over. We're done here. Excellent work.
I'm probably not gonna get good link because I did that in probably timer as well. Yeah, no aneurysms ruptured. Probably a chain. I'll make sure none of them analyzed, I guess, and probably a time limit. I'll take it.
Columba and Cornix's brain electrodes and pump units may seem cutting edge, but it won't be long before they're made available to the general public. Just like the pacemaker. Professor Wilkins had one. Why do I have this nagging feeling? Everyone who's contracted stigma has had some kind of artificial agent in their body. Even that one patient who was transferred here had Syntex Q heme blood. I was using artificial blood with my test mouse too. I wonder if there's a connection.
Dr. Vaughn, can I trouble you for a moment?
Of course.
I wanted to check on the Deputy Secretary's condition.
I doubt I can tell you more than you already know, ma'am. Since he was brought here promptly, cerebral ischemia was kept to a minimum. And there are no signs of severe paralysis, so we shouldn't have to worry about any after effects. We can't use the MRI, so we'll take another CAT scan tomorrow. Will you be advising on his rehab, ma'am?
Yes, I will. I also need to administer a personality test. Because of his implant, he must be closely monitored. It's sad, really. He's such a talented man.
Yeah, I feel sorry for the guy. But I'd like to leave him in the hands of the others so I can concentrate on Stigma.
Agreed. And Dr. Vaughn, it's a shame that you feel the need to keep secrets from us, but I'm hoping that will change.
What makes you say that?
Your cutaneous muscles seem a little more tense than normal. I'm out of practice when it comes to reading faces. Was my assessment accurate? You're a critical part of the Caduceus team. I hope you're not thinking of leaving.
Of course not.
Oh, trying to. I don't want to do that. When he talks. That one actually took some time. So I will be ending it off here. We see you guys in the next video where we tackle money talks. So goodbye.